Phosphorus is not a trendy bonus mineral. It sits inside ADP, the phosphate transfer steps that help cells use glucose, and the signaling pathways that connect food to usable energy after meal. Before anyone shops a phosphorus bottle for bone slogans or clotting promises, start with that quieter job. This mineral is infrastructure for cellular energy bookkeeping, not a stimulant you feel within minutes of swallowing a capsule for supposed vitality. A 2026 systematic review asked what happens when healthy adults take inorganic phosphorus with meals. 10 randomized crossover trials totaling 225 participants measured diet-induced thermogenesis, postprandial glycemia, and postprandial lipids as primary endpoints. Secondary looks included energy intake, satiety, and weight change. That is enough evidence to ask a serious metabolic question, and still far too small for sweeping over-the-counter supplement advice sold as all-purpose energy insurance for every adult diet.
Hold on. Energy supplement videos talk as if phosphorus is a simple vitality stack you can buy for all-day drive. If those crossover trials are that limited, what actually moved after the meal, heat production, blood sugar, or blood fats, and what stayed messy enough that a bottle should not promise all three at once?
The selective answer is thermogenesis first. 3 of 4 heat production studies found a significant rise in diet-induced thermogenesis after phosphorus. Postprandial glucose and lipid responses did not settle into one clear direction across the same healthy adult set. So if a label promises sharper blood sugar control or cleaner lipids from a phosphorus pill alone, that claim outruns the available trial evidence and skips the reviewer's own caution about heterogeneity and modest samples that limit causal inference.
Then why do bone health and clotting ads still put phosphorus on the label like a hero nutrient? Is skeletal biology actually the stronger case for a dedicated supplement in everyday adults, or is that mostly packaging borrowed from ordinary food mineral lists people already eat without thinking about a capsule?
Most body phosphorus does live in bone mineral with calcium, so adequate dietary phosphorus supports that scaffold. Vitamin D research also reminds us the mineral network is linked. Vitamin D2 can lower parathyroid hormone and raise calcium, while serum phosphorus itself often barely budges. For generally nourished adults, bone health is a diet and hormone system, not a single phosphorus pill lever you can isolate from calcium intake, vitamin D status, and protein pattern. Think in exposure pathways, not just the element name on a label. Organic phosphorus in meat, dairy, legumes, and grains arrives wrapped in a food matrix and is absorbed less completely. Inorganic phosphate additives used for texture, moisture, or leavening can deliver a faster, higher absorb load from the same nominal mineral. For everyday exposure control, reading ingredient lists for phosphate additives often matters more than chasing an elemental milligram on a supplement facts panel.
That additive point scares me for kidney disease. If kidneys already struggle to clear phosphate, is buying a phosphorus supplement almost never a casual wellness add-on? And should phosphate-heavy processed foods get the same caution as the bottle instead of being treated like ordinary grocery filler?
In healthy adults' secondary outcomes, higher phosphorus intake associated with lower energy intake, greater satiety, and less weight gain. Those signals are biologically interesting after meals because they sit near the same energy pathways we opened with. The reviewers still temper them with modest samples and heterogeneous methods. So treat the pattern as a hint about meal handling, not permission to self-prescribe phosphorus capsules for fat loss or appetite hacks.
If someone still wants a product for meal satiety or post-meal heat production, what real intake gap or lab context would make that clinician-guided rather than internet-guided, especially when ordinary food and additives already supply plenty of phosphorus for many adults before any bottle enters the cart?
Best fit contexts are narrow, low dietary intake, specific clinical deficiency or refeeding plans, or a clinician actively managing mineral balance. For many omnivorous adults eating dairy, meat, legumes, or packaged foods, total phosphorus exposure is already common before any capsule appears. Excise broader caution still applies. Supplement evidence varies widely, and commercial bottles may not match the preparations used in the crossover studies that measured thermogenesis after mixed meals. Chronic kidney disease can flip the usual wellness script. Renal nutrition practice tracks dietary phosphorus closely, and dialysis nutrition care is often about limiting absorbed phosphate, not adding it. One egg protein meta-analysis found egg white supplementation raised albumin while lowering serum phosphorus in dialysis patients. Useful under clinical care, and the opposite of casual phosphorus pills marketed for energy or bone slogans outside a renal plan. If a clinician does trial phosphorus around meals, judge the target you named out loud at the start. Appetite and thermogenesis have the cleaner early signals in healthy adults. If the hope was smoother post-meal glucose or lipids, the systematic review says those endpoints remain inconsistent. So change the expectation or the plan instead of quietly doubling the dose to chase a muddy marker that the evidence never stabilized. Keep safety proportional to dose and disease context. Concentrated phosphorus and high additive loads are clinician territory in kidney disease. Supplements can interact with medications and need extra caution with pregnancy, serious illness, or upcoming procedures. FDA and NCCIH both remind people that dietary supplements are not automatically low risk just because they sit beside ordinary vitamins on a retail shelf.
So the honest close is food matrix first. Watch phosphate additives in processed foods, treat bone and energy biology as real physiology with selective meal effects, and leave bottled phosphorus for a documented gap with a clinician, not for a viral energy claim that skips kidney context and oversells glucose control from a capsule.